Welcome to the Age Gracefully Show with Dr. Michael Grossman, the well-known anti-aging stem cell and regenerative medicine specialist, best-selling author, and founder of the OC Wellness Clinic in Irvine, California. Each week, he shares the latest information to help you look and feel your best so you age gracefully. And here's your host, Dr. Michael Grossman.
Hi, I'm Dr. Michael Grossman. I'm an anti-aging rejuvenation physician. And today we're going to talk about problems that occur in the bedroom as we age, for both men and women. We're going to talk about it in a way that we can use this in many different settings. So I may be a little restricted in talking clear specific languaging. But the problems that we have in functioning the bedroom as we get older is that our body begins to age in various ways. We have problems with arteries clogging. It's a problem all over our body. In our brain, we lose our memory, we get a little confused, we lose circulation in our legs, we get pain with activity because we don't have enough blood supply going through various blood vessels. This can happen because of cholesterol, can happen because of diabetes, high blood pressure. A lot of different things will create that problem of clogging of our arteries. We also get nerve injuries, particularly with things like diabetes, where the high blood sugar causes parts of our body to lose nerve functioning. So for diabetics, often they get pain in their legs, which is a big problem. But that same area can affect the pelvis and cause for men and women to have a loss of functioning in those areas because you're not having the right amount of nutrition and oxygen and blood flow coming into those areas. And then specifically you get damage in these nerves and you lose sensation. Loss of sensation is a huge issue with functioning in the bedroom. Then we get what we call as leaking membranes. In the face, when you get older, everything sort of sags and gets less resilient. You squeeze your skin and it doesn't pop back like when you were a young person. When the elasticity and the health of the cartilage in the pelvic area diminishes, we get leakage of membranes. So ED is a big problem when things leak through in order to have firmness in functioning the bedroom. You can lose that firmness, and one of the great big causes is leaking. So things leak through these membranes, and then firmness is not something that happens. So that can affect both men and women. For men, it's very, very obvious when that happens. For women, not so obvious, but it is also a problem. Things don't function as well. So experiencing pleasure, enjoyment begins to change as we age. And a lot of it, I'd say most of it, is a function of the physiology changing in our bodies. So what can we do about this? Well, we want to correct the underlying problem so it doesn't keep getting worse. So that is a standard kind of a treatment where you're dealing with correcting diabetes, correcting high blood pressure, high cholesterol, reversing artery clogging and testing for it and taking different nutrients and herbs. A lot of things to be done for that. But specifically, now that you have the damage, how do you repair it? Well, until 10 years ago, we really didn't have very much to do specifically to repair it. But now we do. We have very, very, very great interventions. So one intervention is called Gaines Wave. Gaines Wave is a vibrational therapy that involves using an acoustic wave instrument. It's shaped kind of like, a straight instrument that vibrates. Different than ultrasound. You've seen ultrasound where it's a big kind of instrument where you put it on different parts of your body and where it's hurting and it vibrates it. The Gaines wave is a different kind of vibration. We call it acoustic wave. It's a kind of a sound wave, but not ultrasound. It allows the body to receive a signal, a vibrating signal that vibrates very intensely at a certain wavelength. And this wavelength shakes up all the cells in a certain way that a signal is sent into the cell that, oh, there may be some damage going on. You better send out a repair signal. And when that repair signal goes out, it travels through the bloodstream, and then the body will send in repair cells, which are all kinds of growth factors that are contained in little vesicles. So we call them exosomes. And these will swim into the area and analyze what the problem is and create activity to repair that problem. It's a magical process that the body naturally uses to repair any kind there's damage in the body. It will send in these exosomes, and the exosomes will repair whatever the damage is. And that's what makes it so amazing. We don't have to know what the damage is. We just send in the signal, and the body will send in the repair army. Come on in and repair this area. When you cut yourself, you don't know how the body repairs it. When you have a bad bruise, you don't know how the body will just send in signaling and send an army of repair cells to repair the problem. So the Gaines wave will do that. It's a very easy treatment. It's a painless treatment. It feels peculiar because it vibrates a lot, but it's safe and very effective to repair any damage that's occurring in that part of the body. You can use it in any part of the body. I repair elbows and knees and shoulders and all kinds of tears and so on. It works great, but specifically for injury in the pelvic area, it's fantastic. And it works for women as well as men. And when we repair these areas, it's a slow process. It takes 6 weeks to get the repair to occur. When you break your bone, it takes 6 weeks for something to repair. When you injure your cartilage, it takes 6 weeks to repair it. It doesn't repair in a day. It takes 6 weeks. It's a slow process of repair. We usually do the Gaines wave once or twice a week. Do it 6 times, wait 6 weeks, see how much better you've got. A lot of people, they're good. For some people, you're going to do a little bit more. Most people are going to do really, really well after 6 weeks. So that's one area of repair that we do, and very, very effective. The next thing that we do that's extremely effective is platelet-rich plasma injections. So platelet-rich plasma is taking your own blood. Your own blood is filled with platelets whose job it is. These are little vesicles. They're not actually cells. They're just little containers. These cells will, these vesicles will react when you have an injury, a tear or a bruise, and they will create a clot to stop the bleeding. And then they send out a signal. Okay, there's an injury here. Please repair it. That's your own body. And we use that to take your blood, concentrate these platelets in a little portion of the blood. So instead we take like 60 cc's of blood, then we're left with 5 or 7 cc's of blood that are concentrated, filled with these platelets and growth factors. And we inject it back into your body, and we can inject it anywhere, into your shoulder, your knee, your hips, wherever you're hurting. But specifically now we're talking about into the pelvic area where it reverses ED. It will signal the body, please repair the damage that's occurred. Sometimes the damage is obvious. Sometimes there's funny curvatures in the body that have happened from injury and scarring. Sometimes there's no obvious injury, but the platelets, they go in, send out a signaling, and the body will just repair whatever the damage is. Again, slowly. We do one injection, And then you wait 6 weeks and see how much better things are. Most people will get much better with one injection, and some people need more than one. So if something is going on a few months, one is probably fine. If something is going on for many years, you may need more than one. But it works really well for men and women. For any kind of an issue, for a man or a woman that relates to functioning in the bedroom, these things are fantastic. Because otherwise, we don't have good repair processes. We have tablets that may help, that restores some amount of functioning, but it's not a repair. It just temporarily helps. What I'm talking about here is actually repairing the problem. So it's dramatically effective. And we've used these for like 10 years, and it's really become very, very widely respected because the research is so dramatically helpful. Next thing we do, we have repair vesicles called exosomes. So exosomes we take from the umbilical cord of newborn babies, and there's so many growth factors there. You have about 200 different growth factors. In your own blood, you have about 20 different growth factors in the platelet-rich plasma. So these exosomes from the newborn baby's umbilical cord are extraordinarily potent in signaling the body to please repair this area. And that's not surprising because newborn babies, they are constantly growing and moving and getting things working extraordinarily well. And that's their great asset, is the intensity of the repair process that goes on. And these exosomes are easily injected, just like with the platelet-rich plasma, into any part of the body wherever the damage is. But right now we're talking about into the pelvic area, where we're trying to restore function. And we inject these once. We may combine it with the PRP. They do combine together very well. And it will take about 6 weeks to see how much repair you've gotten. With the exosomes, the repair doesn't stop at the end of 6 weeks. It keeps going on for 3 to 6 months. And it's an extraordinary process that's totally safe, very, very effective, and will restore functioning to whatever part of the body we've injected. So these are things that are extraordinary to restore our functioning in the bedroom. And functioning in the bedroom is so important for men and women because to have a healthy romantic relationship over a period of years, it's very important to have that emotional connection with each other. And the emotional connection is solidified by that functioning in the bedroom. So you don't want to just think it's a unnecessary and it's superficial. No, it's really, really deep emotional connection between a man and a woman. And I encourage each of you to look at the options of restoring vitality and youthfulness so that you can function in the bedroom as if you are a young person. Now, in addition to these things that are necessary, I often will replace bioidentical hormones that we've talked about before. For men and women, testosterone is real important to have the desire to be intimate in the bedroom. As men and women get older, women go into menopause, men gradually will go into their andropause, but they do go into it. By the time a man and a woman are 50 to 60 years old, big changes in how you feel about being in the bedroom. And that is very important to replace testosterone through a variety of possible mechanisms. We can replace them, injections, pellets under the skin, creams, and it can extraordinarily improve and increase your desire to be together intimately. So these things are very, very important for a fulfilling romantic partnership. And I want to encourage you to think about these things. And you're welcome to come and visit me and come to the OC Wellness of Newport Beach, where I am the medical director, and we can work with you and have you restore vitality and fulfillment in your bedroom activities. So thanks so much. Pleasure talking with you. Bye now.
Thank you for watching the Age Gracefully Show with Dr. Michael Grossman. Join us next week for another informative discussion to help you age gracefully. Be sure to visit us at ocwellness.com.